Desde nuestra concepción siempre hemos pensado que esto es algo global, ¿vale? Es decir, Kilómetro Cero es una iniciativa, como digo, global, y como es global, aquí intentamos traer siempre a los mejores, ¿no? Y probablemente pues, esto hace que pues muchas de las ponencias que hoy tengamos sean en inglés, tenéis traducción simultánea, podéis coger sin ningún problema el que quiera lo que es la traducción, en este caso, porque realmente tenemos ponentes de primer nivel y vale la pena escucharlo, ¿no? Este yo creo que es uno de los casos. Vamos a hablar en este caso de, por mucha tecnología, por mucho avance que tenemos, ¿no? Y esto es una realidad, al final seguimos fallando en todo lo que tiene que ver con nutrición saludable, ¿no? Como antes he dicho en alguna ponencia, casi 800 millones de personas siguen pasando hambre, ¿no? A fecha de hoy, y esto es una realidad, con lo cual yo creo que tenemos en este caso una misión importante, que es conseguir que toda esa alimentación saludable llegue a más personas, ¿no? Para ello tenemos el honor hoy de contar con Martin Bloem. Bueno, la verdad es que tiene una trayectoria impresionante, es un profesional de salud pública y nutricionista, tiene amplia experiencia en múltiples organizaciones a nivel mundial, prestigiosa. Actualmente es profesor de salud ambiental en el Departamento de Ingeniería y Salud Ambiental de Johns Hopkins en Baltimore, personalidad en este caso relevante. Fue director del Centro Johns Hopkins para un Futuro Habitable de 2017 a 2022 y antes de lo que es su carrera académica ha ejercido en este caso posiciones relevantes, especialmente en el Programa Mundial de Alimentos en Naciones Unidas, con lo cual yo creo que es un placer para nosotros que nos hable en este caso acerca de cómo podemos solucionar estos problemas, con lo cual, Martin, it's a pleasure to have you here, so it's your time, the floor is yours. Por favor, un aplauso para Martin.
Okay, so let me first, thanks to Bea that she invited me here. Like a couple of months ago, I was in Madrid and met many of you who are among the audience now here also. And there was a fantastic meeting. And when she was explaining about this meeting, I thought, wow, this is so cool, so interesting with all the startups. Because, I think it's very critical. If you look, I'm a big fan of football. And, they have many systems, as we know. As we all, most of us like football, no? But the winner is always when you can play between the lines, as we know, And Spain is a great team, a great example that they always play between the lines. And startups likes that, no? Startups are within a big system. You can be creative and you can say, okay, I can do this. And it's a bit, but you need to understand the context. So what I would try to do in the next 15 minutes or so to give you the context. And some of you have seen the presentation, but I've added some of the work I've done, I'm doing now recently. So let me first start, I'm an old UN guy, before I joined Hopkins. And so these are the Sustainable Development Goals. And, yesterday we had a very, very good meeting discussing, 6, 7 important topics. And you could see that it's actually quite complex. So it's the same when we have the Sustainable Development Goals, because they are all important, but it doesn't mean that when you have a solution for one particular goal, that there's no unintended consequences for another goal. And that's what I will try to discuss today a bit, that, these goals are sometimes competing with each other. So a couple of years ago, and I know the next paper will come out very soon, there was an Eat Lancet paper. And among the nutrition world, this was a very important paper, because for the first time, they were linking, in fact, diets with climate. And they said, and not only with climate, but also with health, particularly actually focusing on what we said, the non-communicable diseases, the NCDs. And this paper was received in a mixed way, because a lot of people loved it, that we finally had a diet which was sustainable. At the same time, the paper was based on what we call a lot of the, large, measuring, these are modeling papers. So when you do modeling papers, those are systems. Again, what I said before, that doesn't mean always that if you look at some of the elements which you put into the modeling, if you look very critically at that, it will be a bit different. And that's one of the issues. So the main focus of the paper was looking at obesity. And, looking at Europe, US, it makes sense that you focus on obesity. It's a huge problem in the world, and you can see that, and actually it's growing also in many in the low and middle income countries. And like, in the US, it's very clear, it's even above, 50%, like, you have this incredible impact, which has a lot of cost for the healthcare system. But not only, as we remember, COVID was an infectious disease, but people who were obese had a much higher mortality risk than others. So this goes beyond, in fact, only cardiovascular diseases or NCDs. So, as I mentioned, what a lot of people don't know is that if you go to low and middle income countries, it's also the main killer are actually NCDs. It's not anymore infectious diseases. Oh, sorry, it goes too fast. So we discussed it over and over, and I think yesterday we had a discussion, and Bernardo did a fantastic presentation. It's very clear that the food system contributes to greenhouse gas emissions. It's about 30%. People can argue, like, is it 25, 30, but in principle, it's around 30%. And it's mainly because of the production of animal source food. So it's not only that the production of agricultural, particularly, animal production, is not only bad for greenhouse gas emission, but it also pollutes a lot. I don't know the situation in Spain, but I know, in Maryland, for example, the whole chicken industry is really polluting the bay in Maryland, and it has huge consequences. It's all the water. And we know that also it's happening in Holland, for example, because I'm originally from Holland. So this is the diet they propose. So it's mainly a plant-forward diet. So much more emphasis on plants than, in fact, on animal source food. So this diet is very interesting because it's a theoretical diet. And do we eat this diet? Well, in reality, of course, we don't, because in Spain they eat Spanish. Well, nowadays everyone eats international, but still the culture is actually based on where you're coming from. But it's a theoretical diet, and you can actually apply, of course, this diet to many different countries. And that's actually what the world was starting to do after they came up with this diet. So let me go to another goal, and that's the nutrition goal. And so it's zero hunger. So beyond obesity, there are other problems too in the world. And it was interesting, I was talking yesterday to Alex, and he was telling me, and I will discuss that he was not aware of the incredible implications of undernutrition, particularly when you live in Europe or you live in the US. But it's not only overnutrition, it's also undernutrition, which is a huge issue. And this is a picture of stunted children. And you can see that despite the fact that you don't see, if you look at the children, that they are different. They're just not as tall as they should be for their age. So that means stunting. You say, who cares about stunting, no? Because, they're just a little bit smaller. And in the past, people said, look, my culture is different. I'm from India, so, we are smaller. Small is beautiful. Well, maybe that's true, that small is beautiful. But the problem is that the fact that these children are not growing in an optimal way, and particularly it happens in the first 2 years, is a reflection of that many organs and other systems in your body are not growing in an optimal way. So the height of a child is not just an issue, it's a proxy for poor development. And this tells you something, it's brain development. So this picture shows you that, in fact, when you are a normal child, you have a lot of connections in your brain. But when you're stunted, you have limited connections. So this is why this is reflecting in IQ points. So some people say 10 points and 15 IQ points. So you can imagine what kind of implication this has for many low middle income countries when you have a whole population which is actually less intelligent, not based on the fact that the education is not good, but because of the fact that they were stunted when they were a child. So you can see that the problem is still very prevalent in Asia, India, Indonesia. That's already almost 2 billion people. Africa. But even in Latin America and in China, you still see some stunting. So what is actually new is that in the past we were thinking, okay, a child is born and then you can actually try to put the child in a better way, like, you know, you give the right food and you give breast milk and all this works. But recently, many papers in Nature came out and they showed that, in fact, that's far too late. You have to start even not during, that's the original idea, that you have to start, at conception. No, you have to start much earlier, because women who are malnourished, they don't deliver the same baby if they're normal. So this is, you can say, well, we know that, of course. No, but I can tell you, at the global level, people were denying that. And so, in fact, we need to start much earlier than that, which is interesting because it has not been done yet. And you can see for startups, it's a very interesting element because it's so much less controversial to work with women than with babies. So the next one is, I have to be fast, I can see I'm too slow. Poverty. And poverty is, for example, all over the world it's an issue, but it's a much bigger issue when you are from a poor country. So this is, again, so you can work on sustainable food systems, but you also work on poverty when you're a country, low or middle income country. So what's happening? So the World Bank came out with a report, which is very interesting, and they said, what's going on? Why are some of the low income countries not performing well in comparison with some middle income countries, which can actually do a lot of the work, for example, for high income countries? And they looked into it, and they said, actually, it's the human capital. And they brought this term a couple of years ago, and the term is a combination of education, health, and survival. And stunting is one of the indicators, which is part of this composite indicator. So the moment you have a high prevalence of stunting in your country, then automatically you have a low human capital, and it means incredible implications for your economic growth. And you can see here that, in fact, it is linked with GDP. The more GDP you have the higher, I would say, human capital, but it's not completely true. There are countries with the same GDP who does much better than other countries. So that's, again, interesting for startups, because there you can play. So what is the difference between a country who's done well, relatively, and a country who's not done well? So that's the in-depth analysis. There's another issue. We know that, in fact, animal-sourced food, which is really important for the prevention of stunting, and this is a recent report by FAO, who showed that it's absolutely important to have milk, particularly milk. And so now we say, from the first slide I showed you about the Lancet paper, we need to go to plant-based diets, but then we need, in many countries where stunting is high, you need animal-sourced food. So this is, again, contradicting. So when you follow the goal, the SDG goal of against poverty, that will actually counter some of the issues you deal with number 2. So you can see, again, it's quite complex. So we did a paper, and we looked into diets a couple of years ago, 2 years ago, I think. And so what we showed is that, first of all, it was interesting. This graphs, it's a long graph, but it shows you the impact on greenhouse gas emission of the production of 1 kilogram of beef, I think. And you could see that it doesn't mean that 1 kilogram of beef, for example, in Denmark, has the same impact on greenhouse gas emissions than, for example, a production in Paraguay. Actually, the difference can be 16 times. So where you produce the food has implications, too, for, in fact, the impact on the climate. It makes it even more complicated. So what we said, okay, so what about if the country is adopting the diet of the Lancet? Because that's very, important. And what you can see here is that the graph shows you that many countries will actually have a reduction in greenhouse gas emission when they would go to the Lancet-promoted diet. But there are many countries which are actually going and will increase their greenhouse gas emission. You say, oh, why is that? How is that possible? Well, because they already have a plant-based diet and they don't have enough animal source food. So automatically, when they start to have a correct diet, then automatically they will, in fact, increase their greenhouse gas emission. So again, you can see that, like, who are the countries where they will increase? It's Africa again, Indonesia, India, Bangladesh, I think Pakistan too. No, not Pakistan. So the other thing is about the climate, is the last couple of slides I want to show you. Who are the most affected countries in the world by climate? This is not actually Spain, it's not Holland, it's not the US. No, it's in fact the poor countries. Bangladesh and Nepal belong to the top 10 countries who are affected by climate and severe weather events. And so recently I worked on the impact of heat waves on pregnancy outcome, which is another complication. And it's very interesting. It's only recently, you can see that since 2016, that the world literature started to have attention to the impact of, this on pregnancy outcome. And it's quite dramatic. You have, in every stage of pregnancy, you can have a negative impact on the outcomes, both on the mother as well as on the child. And you can see that you have reduced fertility, you see placenta. Well, it's all technical terms as a medical doctor, but what I can tell you, it really does a lot of harm on pregnancy outcomes. So what is interesting, if you say, okay, we know that the impact of heat waves, which are mainly affecting, in fact, you can see that in India, in Pakistan, in Africa, in Bangladesh, have it, on top of the already problem of nutritional deficiency, a bigger impact. Do you think there are studies done in those countries? Hardly any. All the studies looking at this, 90% of the studies are done in the US, Europe, and in China. And even there we found the impact, let alone if you think about the impact of those countries where they have serious heat waves. I'm not saying that we don't have serious heat waves, but not in comparison with those countries. So this is the last slide, and you can see now, suddenly we know, coming back to many of the problems we have discussed yesterday, we have water issues. We have, because of the climate, we have a reduction of nutrients in our vegetable production as well as our staple food. But we also have women who are working on the land a lot in those low and middle income countries. And when you work on the land, we know that already from the US, for example, you get kidney problems. Well, if you're a man, you get kidney problems, and women too, but if you are pregnant, you get actually a lot of other problems too on top of it. So you can see that the complexity of the model, you don't have to look at it very carefully, but I can tell you is that this, if you look from a systematic perspective, it is complex. Complexity means that we need interesting solutions by startups, because they can think that, hey, I can solve this problem. They don't have to solve all the problems, but they can be very specific. So in a way, the story is not very happy. However, I think from a solution perspective, there are a lot of possibilities of trying to help things out. So you need global perspectives, but if you don't understand local circumstances, forget it. Then we don't actually have, solutions for the problems. Thank you.